So we see a lot of like depression and anxiety with adolescents. Sometimes we see like self-harm behaviors, like cutting.
I think it's because they are so isolated, and so when there's not much to do and there's not much around you, I mean, you're kind of stuck, you're doing the same thing every day and there's not a lot of people around. Socializing is is part of human nature, and so if we don't get some of our needs met, it just leads to a lot of mental health downfall.
You see a lot of poverty, and that can put stress on the family, which then causes problems with the teenagers and children.
We're more community-based, so we'll go into the schools. So I know I go to schools here in Clark County. We have two clinicians that go to schools out in Oglethorpe County. Some kids we just see in school, and some we see into the clinic weekly. There's a lot of stigma around mental health too. I think people feel like I don't want to be thought of as a different person. So maybe they feel something is not right, but they don't know what's going on, and so they don't know of the available resources.
Yeah, and especially with teenagers, they might feel like embarrassed if they're having to get pulled out of school and go see a counselor. It can be like a shame factor.
Right now, we only see insured clients. So if they don't have insurance, they usually just have to self-pay, which is really expensive. We're going to switch to a fee-for-service. So that means that clients without insurance, their fees are covered just through the state and through the government. So we will start being able to see more clients and provide more services to people that weren't able to receive them before.